Hey guys, welcome back to another episode with Boris the Midwife. So in today's video, I'll be talking about the danger signs in pregnancy. So for those of you who are just coming to my YouTube channel for the very first time, I am Boris the Midwife, and my YouTube channel is all about midwifery, which entails the sexual and reproductive health of women, labor, delivery, and the newborn care. So please consider subscribing and turn on the bell icon so you won't miss any of my upcoming videos. Okay, the first danger sign of pregnancy that I'll be talking about today is persistent headaches accompanied with blurred visions. This is not something that you should ignore during pregnancy because it can be a sign of either induced pregnancy hypertension or it can be a sign of preeclampsia. But you won't know for sure until you get to a hospital. I mean to a hospital, not to a pharmacy or to a nearby herbalist. It is very important for all pregnant women to undergo a series of tests before they are being prescribed any sort of medications. So the second danger sign of pregnancy is persistent waist pains, lower abdominal pains, or intermittent tenseness of your abdomen. This is a danger sign, especially if it is occurring when you are not yet up to 37 completed weeks of your pregnancy. That means you are probably experiencing preterm labor. If you're having persistent waist pains radiating to your lower abdomen and you're having some intermittent, that's on and off firmness of your abdomen, then this is a sign of preterm labor, which is a danger sign in pregnancy. If you're having these symptoms when you're not yet up to 37 completed weeks of pregnancy, then you should consider this a danger sign of pregnancy. It is known as preterm labor. And the third danger sign of pregnancy I'll be talking about is vagina bleeding. You cannot be pregnant and you are experiencing your menses. Like some ladies who come to the hospital and say they have been bleeding for the past 4 days, they thought it was their menses. Menstruation or menses doesn't occur during pregnancy. A vaginal bleeding can mean a lot of things during pregnancy. It can be that your placenta is abnormally low, that it is close to your cervical os, or it can be that the placenta has partially or completely separated. And vaginal bleeding can also be a result of, it can be considered as straightened abortion due to an infection. But like I said before, we won't know for sure until you head to a hospital where some lab tests will be done so that you can be properly diagnosed and the exact medications will be prescribed. Don't head to a pharmacy, please, because a pregnant woman should not take any unprescribed medication or over-the-counter medications. The only medication that a pregnant woman can take during pregnancy is paracetamol, and this should be done in moderation. So please, when you notice any of these danger signs, please head to the hospital. And now the fourth danger sign of pregnancy that I'll be talking about today is reduced fetal movements. So a pregnant woman needs to be conscious or needs to be aware of when the baby's movements are going to start. So for primigravidas, that's women who are pregnant for the first time, they can start experiencing fetal movements from the 20th week of gestation or the 20th week of their pregnancy. But for multigravidas, that's women who have been pregnant more than once, they can start experiencing these first fetal movements from the 16th week of gestation. This is known as quickening. Quickening is the very first fetal movement of your baby in the womb. So if at one point in time you notice that there is some decrease in the movements of your baby in the womb, then it's a call for concern. Because at 16 weeks of gestation, there is adequate space for your baby in the amniotic sac. So if there is some decrease in fetal movements, then there's a possibility that there is decrease of that amniotic fluid, which should not occur, because if there is decrease in amniotic fluid at that early age of pregnancy, then there's a possibility that the baby might grow with some malformations. There's not going to be any musculoskeletal symmetrical development. That means one hand of the baby, for instance, can be longer than the other, because when the amniotic fluid is not sufficient, the uterus is going to apply a lot of pressure on the baby, and the baby is not going to grow symmetrically, and this can cause a lot of malformations. And these reduced fetal movements can be as a result of an infection, because it's not normal for a pregnant woman to stay at home or be at her job site, and maybe for a day or two she hasn't felt fetal movements, or you have noticed that at one point in time there is decrease in fetal movements. Then this is a call for concern. Even if you have been given an appointment, that's an antenatal appointment, in 2 weeks or in 3 weeks, it does not mean you should go and consult only on that appointed day. It is something that should prompt you to go to the hospital immediately and discuss with your midwife or your doctor, because this is a danger sign in pregnancy that all women of reproductive age need to be conscious about. And for the fifth danger sign in pregnancy, I'll be talking about swollen feet, swollen hands, and swollen face. If you're experiencing any of these signs during pregnancy, this can mean pregnancy-induced hypertension or pre-eclampsia, but you won't know for sure until you head to the hospital. And I will still emphasize on this fact: any pregnant woman who is experiencing any of these danger signs during pregnancy should not head to a pharmacy or to a herbalist. You need to head to a hospital, because a pregnant woman should not take any unprescribed medications. Like I said before, the only medication that a pregnant woman can take during pregnancy is paracetamol, and this should be done in moderation. So guys, please be conscious about all these danger signs in pregnancy. So guys, we have come to the end of today's episode. Hope you have learned something new. Please do not forget to share to others. And remember, you can always comment in the comment section below and tell me a topic you would like for me to do a video on, and I will do my best to make that happen. So please give this video a thumbs up, subscribe, and turn on the bell icon so you won't miss any of my upcoming videos. This has been Boris the Midwife. Your health is my priority. See you all in my next video.